Okay, good morning everyone. Today we're going to talk about bipolar disorder. So the first thing we need to know about bipolar is one of the mood disorder. It is like depression. Depression is one of the mood disorder, and also bipolar is one of the mood disorder. So what does this mean, bipolar? The patient will have two episodes, two different episodes or two stages. One episode is depression, so he's gonna feel down, feel empty, low energy, feeling guilty, worthless. And another stage, which is mania stage or the manic stage, the patient will have the completely opposite symptoms. He will feel energetic, he will feel active, he will be interested in doing so many things, and we call this mania. Also, there's something else called hypomania, and we will discuss the difference between mania, but there is a lot of difference between mania and hypomania, but there are a lot of similarities between mania and hypomania. But anyway, so we have one stage which is depression, and the patient feel down. One stage when the patient feel more energetic, which is manic stage. All of us, we have mood swings, and that is normal, like mild mood swings. But these people with bipolar, they have extreme mood swings, from depression, which may lead to suicidal thoughts, to mania, which sometimes lead to feeling of grandiosity and delusions and stuff like that. Some people prefer to call bipolar is manic depressive disorder. What is the prevalence of bipolar? Bipolar represents around 1%. Okay, it's the same as schizophrenia. Schizophrenia also is 1%. But compared to depression, the prevalence of depression is about 12%. Age of onset, bipolar start around the 20. Okay, also schizophrenia start around 20, depression start around 20. So, but you might find the patient started to show some symptoms of bipolar at age of 40. Some patients start at age of 10 or maybe 7. Okay, but most common age of onset is around 20. And the prevalence of bipolar is equal in male and female 1:1. Concerning the symptoms, as I told you, we have two stages. Depression stage. By the way, if you have just the depression symptoms and you have never experienced manic episode, we call this depression or major depressive disorder. But if you have depression, a few months of depression and a few months of manic symptoms, we call this bipolar. So now we will talk about the depressive episode, which look similar to depression, but I told you depression, when depression has another episodes of manic symptoms, we call this bipolar. So depression, as I told you before, depression is 9 symptoms. And to get the diagnosis of depression, you need 5 out of 9. These are the 9 symptoms of depression. The most important symptoms are the first and the second one. So depression means people feel depressed, or they have depressed mood. Also, they lose interest in everything. Loss of interest in any activity that was enjoyable in the past. So depressed mood is one of them, loss of interest. Also, the third one is a change of appetite. Some people will increase, they have increase in appetite, some people will have decrease in appetite. Okay, and this is, both are symptoms of depression. Also, changes in sleep. Some people, when they become depressed, they have insomnia, and some people, when they become depressed, they have oversleeping. So, increase in sleep or decrease in sleep, both are symptoms of depression. Also, change in motor activity or a change of movement. Some people, when they become depressed, they move very slowly and they talk very slowly. And some people, when they become depressed, they become agitated and easily get provoked, and they become restless. So, increase or decrease in motor activity, increase or decrease in sleep, increase or decrease in appetite, these are symptoms of depression. Again, these are 9 symptoms, you need just 5 to get the diagnosis of depressive episode or depression. Fatigue also is one of them. you feel any activity become very tiring. Work at school, work at home, housekeeping, anything. You feel fatigued while doing anything. Also another thing is worthlessness or inappropriate guilt. The patient with depression, they feel worthless and they experience inappropriate guilt. Also decrease in concentration. They cannot focus on any task or in doing anything. The most important one is the last one, suicidal thoughts or thought of death. Any suicidal thoughts also is one of the symptoms. So we have 9 symptoms. If you have 5 out of 9, this gives you the diagnosis of depressive episode, of bipolar, or major depressive disorder if it is just depression. So I told you we have 2 stages. This is one of the stages, or one of the attacks. So now we're gonna talk about manic episode. I told you manic episode is completely opposite to depressive episode. People with manic episode, they need 3 symptoms out of the 7 symptoms. I have this acronym to remind you of the symptoms of the manic episode. GST, pain. G stands for grandiosity. Grandiosity means you have high self-esteem or high self-confidence. And people who start to show manic episode, they start with high self-esteem, and sometimes the symptoms increase, and they start thinking about they have special talent or extraordinary power, extraordinary gift. And sometimes people with high self-esteem, they start to think, oh, I think I am a prophet, or I'm Jesus Christ, or I'm God, something like that. And when the grandiosity increase, we call it delusions of grandiosity. Okay. The second one is the sleep. They sleep 2 or 3 hours maximum a day, and they feel okay. They lack need for sleep. Another one is talkativeness. Talkativeness, they talk a lot and very fast, very quick. Sometimes they cannot notice this by themselves, but other people notice that. And sometimes people around them, they get upset because they are very talkative and they don't allow other people to talk. P is stand for pleasurable activities. People in manic episode, they engage in so many pleasurable activities. But the problem, it is pleasurable activities with negative consequences, such as drug abuse. A lot of people, they are okay once they get into this stage, they start using cocaine, crystal meth, marijuana, something like that. Also another pleasurable activities, they engage in unsafe sex. And sometimes they catch HIV, Hep C, Hep B, or whatever because of unsafe sex. Another thing, it's very common, shopping. A lot of people in manic stage, they spend a lot of money and they lose everything because of the symptom of manic episode. One last thing is reckless driving or driving under influence. All these things happen because they are interested more in pleasurable activities. Some people who are addicted to food, they eat a lot when they are in manic stage. So whatever more enjoyable to you or whatever causes pleasure, you will engage more in these activities. A stands for activity. We mean with activity, goal-directed activity. Like you will find these people attending school and working full-time, school full-time. They go to any social gathering, social activity. They want to do everything because they are energetic. They think they have a high self-esteem, high power. So they want to do everything. I have a client here at the master seat. He's doing all of that. Okay, you can list like one complete list of so many things: social activity, work activity, courses, classes, exercise, so many things. It sounds okay at the beginning, but I want to tell you this leads, like engaging in so many activities like that, it leads to failure at the end. Failure at work and failure at school and failure at social life. Because they cannot focus at any of these activities. Also, one of the things that lead to failure is this one, distractibility. Because they cannot focus, they cannot concentrate. Yes, they go to school regularly, but they cannot focus. so it ends with failure. Also, I stand for ideas. They have something called the flights of ideas. So many ideas in their mind, a lot of racing thoughts. Okay, that's why they are talkative. That's why they are hyperactive. Okay, because they have a lot of thoughts. A lot of them, they invest their money in foolish business. They lose everything. So at the beginning, if you don't have experience with bipolar, when you see patient in this hyperactive symptoms, you feel, oh, that's good, that's great, this is better than depression. But actually, it also leads to impairment in social life, in work, and at home. Bipolar, untreated bipolar leads to legal problem, leads to interpersonal problems, lead to drug abuse. 50% of these patients commit suicide, so treatment is a big thing for this. Again, these symptoms, whatever depressive symptoms or manic symptoms, to get the diagnosis, these symptoms must impair your work or social life. Because sometimes some people are talkative and they just sleep 5 hours a day, and they hyperactive and they engage in so many things, but still they are functioning 100%. There is no impairment, so this is not bipolar. If you are active and talkative more than other people, but you're still functioning, this is not bipolar. Also, for the diagnosis of bipolar, we need to rule out other medical condition or drug abuse. Because sometimes if you have a medical condition like hyperthyroidism, like increase in thyroxine level, this may manifest as bipolar symptoms. So at early stages, when somebody shows some symptoms of bipolar, the first step is to go to the family doctor or a psychiatrist, because he will do some physical exam and he will order some lab work and blood test to rule out any medical conditions that leads to the same symptoms. If we rule out other medical condition, okay, we know this is bipolar and we will treat bipolar as mental health issues. But if it is related, for example, to brain tumor or brain infection or head trauma or hyperthyroidism or increased cortisol levels, there are so many medical conditions that can lead to manic episode, symptoms similar to manic episode. So the doctor needs to rule out these medical conditions. Also, sometimes if you abuse drugs like cocaine or crystal meth, you will become hyperactive and it looks like bipolar. But again, we ask the client, are you using anything? If they are using something, we call this drug-induced psychosis, not bipolar. This is an important slide. Okay, I told you bipolar, 2 stages, depression and manic stage or mania. But there are types of bipolar. There is something bipolar 1, something called bipolar 2, and cyclothymia or cyclothymic disorder. What's the difference? These are the common ones, bipolar 1, bipolar 2. What's the difference? Bipolar 1 is mania and depression. Patient will have some period, like 1 month or 2 months in depression, 1 month or 2 months in mania. But this is depression and hypomania. So the difference is mania and hypomania. What is the difference? The symptoms are the same. The 7 symptoms, GST, PAID, the same acronym, okay? But this one is severe, like the symptoms is very severe. This one is less severe. This one requires hospitalization. Like people, they become hyperactive, energetic, and then they start to be delusional and hallucinating, and sometimes they become aggressive and violent, okay, because of they are full of energy and they want to release this energy. So sometimes they require hospitalization for people with bipolar 1. But bipolar 2, these people are functioning 50%. Like they still talkative, hyperactive, they don't sleep, they have all the symptoms, they engage in so many activities, but still they can focus at work and they can do their job. But there is some impairment, but not full impairment. So again, the difference between both, this one needs hospitalization. In acute stage, this one needs hospitalization. This one doesn't need hospitalization. This one has psychotic symptoms, like he believes he is Jesus Christ, or he is God. But this one, he believes he has some talents and gifts more than other people. The last difference, this one is severe, this one is less severe. This one is mild form of bipolar. Okay, this is, you have hypomania and minor depression. But to get the diagnosis for this one, you need to have the symptoms for at least 2 years. Why? Because sometimes we have minor depressive symptoms, and sometimes we have hypomanic symptoms. But if you have these cycles of depression and hypomania for 2 years, this means that you need treatment. But if you have these symptoms for 1 month, 2 months, that's okay. Again, the bipolar, depression, and manic stage. Okay, but sometimes people will have, okay, our client, you will find our client, most of our clients, they have bipolar 1 or bipolar 2. But if you read the diagnosis, the doctor diagnosis for them, you'll find bipolar 1 with psychotic feature, or bipolar 1 with seasonal feature, or postpartum feature, or catatonic feature, or rapid cycling feature. So these are specific features. It will not change the diagnosis. You still are bipolar, but you can consider this as subdivision or subcategories of bipolar. Let's start with the easiest one, seasonal. What seasonal means that you will have the bipolar episodes, whatever manic or depressive, in certain seasons. Like it's very common in Canada, you'll find patients, they have depression in winter, but they have mania or hypomania in summer. So if it is related to season, certain season, we call this seasonal bipolar, or bipolar with seasonal features. Postpartum, this means you are okay all your life, you don't have any symptoms, but after delivery, you experience bipolar symptoms, just after delivery. So we call this bipolar with postpartum features. Catatonic means you will have bipolar, but with abnormal position. Like I told you before, some people with bipolar or depression, they will stand like this for 3 hours, just standing on one leg or one foot. Okay, and some people will do like this, and they do this position maybe for 5 hours. So if you have abnormal position, body position, with the bipolar, we call it catatonic. And some people with bipolar, they start pacing. Like they walk, they keep walking and pacing for maybe 2, 3, 10 hours all the day. Okay, and we call this also catatonic. Rapid cycling means you have a lot of cycles. Most of patients, every year they have 2 cycles, like, or I mean 2 episodes. But if you have, for a certain year, more than 4 episodes, we call this rapid cycling. So if you have 1 week depression, 1 week mania, 1 week depression, 1 week mania, 1 week depression, 1 week mania, we call that's rapid cycling. Okay, like I met a patient who have 3 or 4 episodes at the same day, not every week. Like in the morning he is manic, then in the afternoon he is depressed, then in the evening he is manic again, then before he sleep he is depressed. So we call this rapid cycling. Psychotic features means that people will have delusion and hallucination with bipolar. Again, what about the risk factors or causes? It is the same with all mental health issues. The main risk factor is this one, the genetic part. Okay, why people develop bipolar? Because the family history. If your parents are bipolar and you have bipolar disorder and your cousin have bipolar disorder, this increases the risk that you're gonna develop or you're gonna show some symptoms of bipolar. And there are some studies that show 65% of bipolar patients, they have family history. Okay, this is the strongest risk factor or cause of bipolar or any mental health. Also high stress can trigger the bipolar. Also drug abuse can trigger the bipolar. So if you have a family history and then you go through divorce or you you get laid off from the work, or unemployment or homelessness. Any stressor in your life can lead to induce bipolar. Also, any post-traumatic experience can trigger bipolar. Like people with negative childhood experience, physical abuse, verbal abuse, sexual abuse, all these can trigger bipolar. Also imbalance in the neurotransmitter, the chemical transmitter in the brain, and some studies say that it is biological differences. The anatomy of the brain from bipolar to normal, people without bipolar is different. He starts smoking cocaine. I told you they engage in any pleasurable activity. He overdosed cocaine, he got heart attack. So side effect of the medication is way less than side effect of relapse. Sometimes we give this also with bipolar antidepressant, but in certain cases. Sometimes we give anti-anxiety, but I told you the main thing is the mood stabilizer. Also tell your client about this. To find the right medication, it takes some time, and it takes some trial and error. Okay, it might take 1 year trying different medication to find what is the best for you. Okay, so because this process requires patience. The problem is our clients, they go to the doctor, they get some pills, they take the pills, it doesn't help for 1 month or 1 or 2 weeks. They say, oh, okay, the medication is not working. No, it is just one type of medication. If you return back to your doctor, he will switch to another one. And then he switched to another one. And as I told you, it is all trial and error. There is no guidelines to show with what you're gonna start or with what you're gonna switch. It is all trial. Every person responds differently to every medication. As I told you, some medication takes weeks to months to take full effect. What if the medication is not working? Another treatment is ECT, or electric shock. Okay? And people usually take from 6 to 8 sessions of ECT. It is everywhere. Some people say, oh no, it is not in Canada. No, in every mental health institute you will find ECT. Okay, but we don't start with this. This is maybe the third line of treatment or fourth line. Also, another one is transcranial magnetic stimulation. So this is about electrical current, but this about magnetic waves. They find all these procedures, it helps to stabilize the mood. Whatever in depression or manic stage, it helps to make the mood stable. This is the ECT. It looks scary, okay, but it is not painful at all because you get anesthesia before you get the session. Okay, so you lose consciousness, you get the shock, and then you wake up and you don't know what happened. So it is not painful, and it's not scary, no side effect. Like if you compare side effect of this to the medication, of course this one is way better. But people don't like it. Okay, so the doctors keep it as third line of treatment. This is magnetic waves. Patient who do this, it doesn't need to take anesthesia or anything. While you are conscious, you can get these sessions. But these sessions take longer time. You need 6 weeks to complete a course of treatment. And you need to come every day. And the ECT is more effective, like the electrical shock is effective more than the magnetic wave. This is a secondary treatment, some vitamins, exercise, but these are good as preventive treatment, not as curative treatment. So if you are taking your medication and you want to prevent further attack in the future with the medication, you can take some supplement, you can get therapy, do exercise, schedule your sleep, diet, healthy diet, try to manage stress. All these are good, but as I told you, primary treatment is the medication. Yeah, this is again, we repeat what we are talking about. What if the patient doesn't take the medication? This is what will happen. Drug abuse, suicide, legal problem, financial problem, relationship problem, isolation. It affects work performance and performance at school. So, yeah, this is what the course of, like this is our last slide. So tell me about the prognosis, like what will happen if I am taking medication, or what happened with most of patients? Actually, most of patients, they spend almost half of their lives symptomatic. And some people, even under medication, they still symptomatic. But of course, the medication control maybe 70% of the symptoms. Still, you will find some people have 30% of the problem still exist. But anyway, some people with the medication cover all the symptoms. Sometimes the medication covers some symptoms. One of the worst things that could happen is the suicide. Suicide could happen with depression. It is more with depression, sometimes happen with manic episode. Okay, I want you to go through this. We will send you the presentation, we will send you the video record, and we will send you the PowerPoint file. So review it, and if you have any question, contact me. Thank you.